Your brain is either cleaning itself or dying while you sleep, after 50. In 2017, the Nobel Prize in Physiology or Medicine was awarded to 3 scientists for their work on circadian rhythms, the biological clocks that govern nearly every function in your body. Not for a drug, not for a surgical technique, for sleep biology. That should tell you something about how seriously the scientific community now takes what happens during those hours when you are unconscious. Here is what that research, and the decade of work that has followed it, has revealed. While you sleep, your brain activates a system that has no daytime equivalent, a network of channels that opens between brain cells and flushes out toxic proteins, including the exact proteins that accumulate in Alzheimer's disease. Your immune system runs its most intensive repair and calibration cycles. Your muscles synthesize the proteins that resistance training signals them to build. Your hormonal system resets. Growth hormone, cortisol, leptin, ghrelin, insulin sensitivity, all recalibrate during specific stages of sleep in ways that cannot be replicated while you are awake. Your emotional memory consolidates. Your procedural memory solidifies, and your prefrontal cortex, the part of your brain responsible for judgment, impulse control, and decision-making, essentially recharges. None of this is optional biology. None of it has a workaround. And here is the part that nobody is talking about loudly enough. After 50, sleep changes in ways that directly threaten all of these processes. The deep sleep stages that do most of this critical work decline sharply with age. The architecture of sleep shifts in ways that look normal on the surface but represent a significant reduction in biological restoration underneath. Today, I am going to show you exactly what sleep does at the cellular and systems level, what changes after 50, what the science says about the consequences, and, most importantly, what actually works to restore sleep quality based on the current evidence. We will dive into all of that in today's episode. I am Dr. Alexander Wellrich. Sleep is the thread that runs through every topic I have covered in this series. Mitochondrial health, gut health, inflammation, NAD+ levels, muscle preservation. Every single one of those systems depends on sleep for restoration. And in 30 years of clinical practice, I have watched inadequate sleep silently undermine the health of patients who were doing everything else right. The frustrating reality is that sleep disturbance after 50 is extraordinarily common. Studies suggest that between 40 and 70% of adults over 60 report significant sleep complaints, and the typical medical response, a prescription for a sleep medication, addresses the symptom while frequently making the underlying biology worse. Most commonly prescribed sleep medications suppress the deep sleep stages that are most critical for brain health and physical restoration. What I want to give you today is something different. A clear understanding of the science and a set of interventions that work with your biology rather than against it. Some of these you have heard before, but perhaps never understood the mechanism behind. Others may genuinely surprise you. If this kind of evidence-based conversation is valuable to you, please subscribe to this channel. And now, let us talk about the most powerful restorative process your body performs, and what happens when it starts to break down after 50. Before I can explain what goes wrong with sleep after 50, I need to give you a brief picture of what healthy sleep actually looks like. Because most people think of sleep as a single, uniform state, and it is anything but. Sleep occurs in cycles of approximately 90 minutes, and each cycle contains several distinct stages. The first stage is light, non-REM sleep, a transitional state as your brain begins to disengage from wakefulness. The second stage is slightly deeper, non-REM sleep, during which your brain produces characteristic electrical patterns called sleep spindles that are associated with memory consolidation. The third stage is slow-wave sleep, also called deep sleep or delta sleep, and this is the stage that matters most for physical restoration, immune function, hormonal regulation, and the glymphatic system that clears toxic proteins from the brain. Then there is REM sleep, rapid eye movement sleep, during which dreaming occurs, emotional memories are processed, and the brain undergoes a distinctive pattern of activation that is critical for psychological well-being and cognitive flexibility. A healthy young adult cycles through these stages multiple times across a 7 to 8 hour night, with the deepest slow-wave sleep concentrated in the early part of the night and REM sleep becoming more prominent toward morning. After 50, this architecture begins to fragment and shallow in specific ways. Slow-wave sleep, that critical deep stage, declines by approximately 2% per decade after age 30, meaning that by 60, many adults have lost 30 to 40% of the deep sleep they had at 30. A study published in the journal Neuron found that slow-wave sleep in adults over 60 was so reduced that in some individuals it was barely detectable on brain monitoring equipment. Total sleep time often shortens. Sleep becomes more fragmented, more awakenings throughout the night. The circadian timing of sleep shifts earlier, so people feel sleepy earlier in the evening and wake earlier in the morning, often fighting that tendency with artificial light and caffeine and ending up with a chronically compressed sleep window. And critically, the sensitivity of the brain's sleep pressure system, the system that builds the drive to sleep throughout the waking day, weakens with age. Young adults build strong, reliable sleep pressure across a day of waking that produces deep, consolidated sleep at night. Older adults often build weaker sleep pressure, contributing to lighter, more easily disrupted sleep. Understanding these changes is not just academic. They explain why the sleep problems of adults over 50 require different solutions than those of younger people, and why solutions designed for younger adults often do not translate. Now let me be direct about the consequences, because I think most people significantly underestimate the biological cost of inadequate sleep, particularly after 50. The most alarming connection in the recent sleep research is the link to Alzheimer's disease. The glymphatic system, the brain's waste clearance network that I mentioned in the hook, is almost exclusively active during deep, slow-wave sleep. It works by allowing cerebrospinal fluid to flow through channels between brain cells, flushing out metabolic waste products. The primary waste products it clears include amyloid beta and tau, the two proteins that accumulate in the brains of Alzheimer's patients to form the plaques and tangles that destroy neural tissue. A landmark study published in Science found that even a single night of sleep deprivation produced a measurable increase in amyloid beta accumulation in the human brain. Not years of poor sleep? One night. A follow-up study from the National Institutes of Health, published in JAMA Neurology, found that adults who reported sleeping 6 hours or fewer per night in their 50s and 60s had a 30% higher risk of developing dementia compared to those sleeping 7 or more hours. This is not a soft association. This is a mechanistic biological connection between sleep duration, glymphatic clearance, and the most feared neurodegenerative disease of aging. The cardiovascular consequences of poor sleep are equally serious. A meta-analysis published in the European Heart Journal, analyzing data from over 470,000 participants across multiple countries, found that sleeping fewer than 6 hours per night was associated with a 48% increased risk of developing coronary heart disease and a 15% increased risk of stroke. The mechanisms include elevated cortisol, increased sympathetic nervous system activity, impaired vascular repair, and disrupted blood pressure regulation, all of which occur during inadequate sleep. The metabolic consequences are direct and measurable. A study published in Annals of Internal Medicine placed participants on either adequate or restricted sleep while on a calorie-controlled diet. Those sleeping 5.5 hours lost significantly less fat and significantly more muscle mass than those sleeping 8.5 hours, despite identical calorie intake. Sleep deprivation reduces growth hormone secretion, increases cortisol, impairs insulin sensitivity, and elevates ghrelin, the hunger hormone, while suppressing leptin, the satiety hormone. The result is a metabolic environment that promotes fat storage and muscle breakdown simultaneously. For immune function, research published in the journal Sleep found that adults sleeping fewer than 7 hours were nearly 3 times more likely to develop a cold after being exposed to the rhinovirus compared to those sleeping 8 or more hours. Your immune system does not have an equal opportunity relationship with your waking and sleeping hours. It does its most important work while you sleep. A few years ago, I worked with a patient I will call Frank. He was 59, a small business owner from Seattle, Washington. Driven, disciplined, proud of his ability to function on 5 to 6 hours of sleep per night. He considered adequate sleep a luxury he had never had time for. He came to see me because his memory was noticeably slipping. Names, appointments, words, in ways that frightened him. His energy was unpredictable. He had gained weight despite no change in his eating habits, and his blood sugar had moved into the pre-diabetic range. His standard workup was largely unremarkable except for those metabolic markers. But when we looked at his sleep in detail, and I mean really looked with a sleep diary and eventually an overnight monitoring study, the picture was stark. Frank was averaging 5.4 hours of actual sleep per night. His slow-wave sleep was minimal. He had multiple awakenings he was not even aware of. We did not start with medication. We restructured his sleep environment, his evening routine, and his morning light exposure using the behavioral and circadian principles I will describe shortly. Within 8 weeks, Frank was averaging 7.2 hours of consolidated sleep. Within 3 months, his memory complaints had reduced significantly. His fasting blood sugar had returned to the normal range, and he had lost 11 pounds without changing his diet. He told me he felt like he had spent a decade running his business through fog, and the fog had lifted. And here is what most sleep advice misses entirely. The single most powerful lever for sleep quality after 50 is not in your bedroom at night. It is what you do in the morning. Let me explain why. The circadian clock, your body's internal 24-hour timing system, governs the sleep-wake cycle more powerfully than almost any other factor. And the primary input that sets and maintains your circadian clock is light, specifically the blue wavelength light of natural daylight, received by specialized cells in your retina called intrinsically photosensitive retinal ganglion cells. These cells send signals directly to the suprachiasmatic nucleus in the hypothalamus, the master clock of the brain, which then synchronizes every peripheral clock in every organ and tissue in your body. When your master clock receives strong, appropriately timed light signals, it produces a robust, well-timed circadian rhythm that generates strong, consistent sleep pressure and appropriately timed melatonin release in the evening. When those light signals are weak, mistimed, or absent, as they often are for adults who spend most of their day indoors under artificial lighting, the circadian system becomes desynchronized, sleep pressure weakens, melatonin timing shifts, and the sleep-wake cycle fragments. The research on morning light exposure for sleep quality is remarkably consistent. A study published in the Journal of Sleep Research found that office workers who received bright light exposure in the first hour after waking had significantly better sleep quality, mood, and alertness compared to those who did not. Research from Stanford neuroscientist Dr. Andrew Huberman, whose work on the circadian system has been published across multiple peer-reviewed journals, identifies morning sunlight exposure as the single most important behavioral input for circadian health. The mechanism is specific. Within the first hour of waking, exposure to bright outdoor light, or a bright light therapy lamp if outdoor access is not possible, triggers a cortisol pulse that sets the circadian timer and predicts the timing of melatonin release approximately 12 to 16 hours later. If you go outside into morning light at 7 a.m., your brain will begin producing melatonin and generating sleep pressure around 9 to 10 p.m. If you delay that light signal, staying indoors all morning, that entire cascade delays, making it harder to fall asleep at an appropriate time. 10 to 30 minutes of outdoor light exposure within the first hour of waking, without sunglasses. The light needs to reach those retinal cells. This single habit, practiced consistently, is one of the most powerful free interventions for sleep quality that I can offer you, and it costs nothing but a brief walk outside. The companion to this is evening light management. In the 2 to 3 hours before your intended sleep time, dimming your indoor lighting and minimizing blue wavelength light from screens allows melatonin to rise without suppression. A study published in the Journal of Clinical Endocrinology and Metabolism found that exposure to room light before bedtime suppressed melatonin by more than 99% compared to dim light conditions, and delayed its onset by 90 minutes. 90 minutes of melatonin delay from normal indoor lighting in the evening. This is happening in most American homes every night. Let me now give you the evidence-based toolkit, starting with the behavioral and environmental interventions that research consistently supports, then moving to supplement and pharmacological options where the evidence warrants discussion. Cognitive behavioral therapy for insomnia, known as CBT-I, is the gold standard treatment for chronic insomnia according to multiple clinical guidelines, including the American College of Physicians. A meta-analysis published in the Annals of Internal Medicine found that CBT-I produced greater long-term improvements in sleep onset, sleep efficiency, and total sleep time than sleep medications, and without the dependency risks or the suppression of slow-wave sleep that pharmacological options often produce. CBT-I is available through licensed therapists and increasingly through digital platforms and apps that have been validated in clinical trials. Temperature is the second most powerful environmental lever after light. Your core body temperature needs to drop by approximately 1 to 2 degrees Fahrenheit to initiate and maintain sleep. A bedroom temperature between 65 and 68 degrees Fahrenheit is supported by research as the optimal range for most adults. A study published in the journal Sleep Medicine Reviews found that elevated bedroom temperature was one of the most reliable disruptors of slow-wave sleep, the deep sleep stage most diminished with age. Cooling your bedroom is one of the most direct investments in sleep quality you can make. Magnesium deserves special attention as a nutritional sleep support. Magnesium regulates the GABA system, the brain's primary inhibitory neurotransmitter system, and is involved in melatonin synthesis. A randomized controlled trial published in the Journal of Research in Medical Sciences found that magnesium supplementation significantly improved sleep quality, sleep duration, and early morning awakening in older adults with insomnia. Magnesium glycinate or magnesium threonate are the forms with the best evidence for sleep-specific benefits and the best tolerability. A dose of 200 to 400 milligrams taken 30 to 60 minutes before bed has been used in clinical studies. Low-dose melatonin is worth discussing carefully because most Americans are using it incorrectly. The standard doses sold in American pharmacies, 3, 5, and 10 milligrams, are pharmacological doses that work by sedating rather than by synchronizing the circadian clock. Research published in the journal Sleep Medicine Reviews found that doses of 0.5 to 1 milligram, taken 2 to 3 hours before intended sleep, are more effective for circadian synchronization and have fewer next-day side effects than the high doses commonly sold. If you are using melatonin for sleep support, timing and dose matter far more than most people realize. On the topic of pharmaceutical sleep aids, benzodiazepines and Z-drugs like zolpidem, soldazambian, I want to be direct with you. These medications produce sedation, not natural sleep architecture. Multiple studies have demonstrated that they suppress slow-wave sleep and REM sleep, the very stages most critical for brain health and physical restoration. A large study published in the BMJ found that older adults using these medications had a significantly increased risk of dementia, falls, and hip fractures. For short-term acute insomnia, they have a role. For long-term management of the sleep changes that come with aging, The evidence strongly favors behavioral and circadian approaches. Let me close the core content with 3 behavioral factors that have outsized effects on sleep quality after 50, and where common habits are frequently working against people. Exercise is powerfully beneficial for sleep, but timing matters significantly after 50. Research published in the journal Sports Medicine found that moderate aerobic exercise performed in the morning or early afternoon reliably improved sleep onset, slow-wave sleep, and total sleep time. Exercise performed within 2 to 3 hours of bedtime, however, particularly vigorous exercise, elevated core body temperature and cortisol in ways that disrupted sleep onset for many adults. The general principle? Exercise early, sleep better. If evening is the only time available, keep the intensity moderate and finish at least 2 hours before bed. Alcohol is perhaps the most widely misunderstood sleep disruptor in the American adult population. Many people over 50 describe using a glass of wine or a drink in the evening to relax and fall asleep more easily. The pharmacology is real. Alcohol does have sedating effects that reduce sleep latency. The problem is what happens in the second half of the night. As alcohol is metabolized, it produces a rebound activation of the nervous system that fragments sleep, reduces REM sleep dramatically, and suppresses slow-wave sleep. A study published in the journal Alcoholism, Clinical and Experimental Research found that even moderate alcohol consumption, 1 to 2 drinks, reduced REM sleep by 24% on the night of consumption. For people already experiencing the age-related reduction in slow-wave and REM sleep, alcohol in the evening is a significant additional suppressor of the very sleep stages they most need. Caffeine has a half-life in most adults of approximately 5 to 7 hours, meaning that a cup of coffee consumed at 2 p.m. still has half its caffeine load circulating in your system at 7 p.m. After 50, the enzyme that metabolizes caffeine, CYP1A2, often becomes less active, meaning caffeine lingers longer. Research from the Journal of Clinical Sleep Medicine found that caffeine consumed even 6 hours before bedtime significantly reduced total sleep time. The practical guidance. For adults over 50, a caffeine cutoff of noon, or at most early afternoon, is supported by the evidence. Here is your evidence-based sleep protocol, step by step. 1. Get outside within the first hour of waking every single morning. 10 to 30 minutes of natural light exposure, without sunglasses, as close to the time the sun appears as practical. Overcast days still provide enough light. This is the master switch for your entire circadian system. 2. Set your bedroom temperature between 65 and 68 degrees Fahrenheit. If your partner prefers a different temperature, a dual-zone electric blanket is a practical solution that has been validated in sleep research. Cooling the sleep environment is one of the most direct ways to improve slow-wave sleep. 3. Dim your indoor lights in the final 2 to 3 hours before bed. Remove overhead lighting and use low, warm-toned lamps. If you use screens in the evening, enable night mode or use blue light filtering glasses. The goal is to allow melatonin to rise naturally without suppression. 4. Establish a consistent sleep and wake time 7 days a week, including weekends. The circadian clock is entrained by consistency. Sleeping in significantly on weekends creates what researchers call social jet lag, which disrupts your sleep architecture for the following nights. 5. Consider magnesium glycinate or magnesium threonate at 200 to 400 milligrams, taken 30 to 60 minutes before bed. Discuss with your physician, particularly if you take medications or have kidney concerns. This is one of the best evidenced nutritional supplements for sleep quality in older adults. 6. Move your caffeine cutoff to noon. It may feel significant for the first week as your body adjusts. Within 2 weeks, most people find their afternoon energy stabilizes and their sleep deepens noticeably. 7. If alcohol is part of your evening routine, consider the trade-off clearly. 1 drink suppresses REM sleep by roughly a quarter. If sleep quality is a priority, and given everything we have discussed today it should be, This is a lever worth examining honestly. Let me bring everything together. Sleep is not passive. It is the most active restoration process your body performs. Every night, your brain clears the proteins associated with Alzheimer's disease. Your immune system runs its intensive repair cycle. Your muscles build the tissue that resistance training signaled them to grow. Your metabolic hormones recalibrate. Your emotional processing consolidates. Your cardiovascular system repairs. After 50, the architecture that enables all of this changes in ways that require intentional, science-based response. Not medication that sedates you into a chemically produced unconsciousness that suppresses the very stages of sleep you most need, but behavioral, environmental, nutritional, and circadian strategies that work with your biology to restore the quality of sleep your body is still fully capable of generating. Frank's story is not unusual. The sleep changes that most adults over 50 accept as inevitable are frequently addressable. The science is there. The tools are accessible. The investment in your sleep is an investment in your brain, your heart, your metabolism, your immune system, your muscles, and your emotional resilience, simultaneously, every single night. If today's episode gave you something genuinely useful, please like this video, subscribe to the channel, and leave me a comment. Tell me, what is your biggest sleep challenge right now? I read every comment. In our next episode, we are going to bring this entire series full circle. We are going to talk about the science of biological age versus chronological age, how it is measured, what drives the gap between the two, and what the research says are the most powerful levers for keeping your biological age meaningfully younger than your birthday. It is the synthesis episode, and I think it will give you a framework for everything we have covered together. Until then, take care of yourself from the inside out.